Hi, welcome back to our discussion. So on today's topic, we're going to be looking at prevalence, incidence, and screening tests, which are different epidemiological concepts that is used in explaining or that is used to show some distribution of disease or some factors, okay, when it comes to public health, okay? So we are still on biostatistics discussion, and this is a very, very interesting topic that you hear very often all the time, especially as a public health student. So let's quickly dive into our discussion today because I don't want it to take much of our time as we um, proceed. Okay, so the first thing we are going to be noting is what is prevalence? Prevalence measures how common a disease or condition is in a population at a particular point in time or during a specific period. Okay, so it tells the proportion of people who already have the disease, and it also helps to determine a person's likelihood of having a disease. So prevalence helps to measure disease condition in a population at a particular point in time or during a specific period. So there are basically two types of prevalence. We have the point and the period prevalence. What is the point prevalence? It's the type of prevalence that actually tells or measures a particular um, data or epidemiological data at a specific point in time, not at the specific point. For example, if you carry out research on number of people with malaria in Abuja on October 10, 2025, that is, the time is very specific. It helps you to tell the date and the time that you actually, sorry, the date and the moment you actually carried out the research, okay? Why period prevalence? It tells the prevalence rate over a specific period of time. For instance, like number of people with malaria in Abuja between January and December 2025, or you can say number of people with malaria or number prevalence of hypertension in maybe let's say it's from 2020 to 2025. So this period prevalence just like over a specific period of time. But when it comes to point prevalence, it's very straight to the point. Okay, this is the day that this prevalence data was taken. Do you understand? So prevalence actually has data, formula. So it's equals to number of existing cases all over the total population of that is the target population we are looking at times by 100 over 1 if you're changing it to percentage. Do you get? So we're going to be using just have in mind this particular formula because we're going to be using it subsequently to solve questions. Okay, so let's take a look at incidence. What is incidence? Incidence is the number of newly diagnosed cases of a disease. So it measures the number of new cases of a disease that occur in a defined population over a specific period of time. So it actually helps to reflect or determine the risks of developing a particular disease, or it also helps to show how fast a particular disease is spreading or how fast a particular disease is actually maybe getting cured or something. Okay. So incidence differs from prevalence in the sense that incidence is talking about new cases. New cases is just interested in new cases. Why prevalence is talking of okay, existing cases plus new cases, how many people already have the disease, how many people are maybe subsequently contracted the disease, but incidence is just concentrated on new diagnosed cases of a disease. So there's also a formula for incidence, which is a number of new cases during a period all over the population at risk during that particular period. So let's take, for instance, if over the course of 1 year, 5 women were diagnosed with breast cancer, so out of a total of a female study population of 200, that is those who do not have breast cancer at the beginning of the study period, then if you want to calculate the incidence for this particular um, for this particular breast cancer incidence, you know that 5 people, they tell us that 5 people are being diagnosed. That we have new cases of breast cancer at this study period. So it's 5 all over 200, all right? That's which is the study population, the population we are looking at, or the population that is the defined population when we are carrying out this incidence research. So it's 5 over 200, which is equal to 0.0 0.025. So our incidence rate is 0.025, and we are converting it maybe to 1%. We are going to be getting 25% incidence rate. And if you're converting it maybe to per 100,000 women, we're going to be getting, you just times the number by 100,000, you're going to be getting 2,500 per 100,000 women per the year of study. Do you understand? So that is it about the incidence. Please, I want you to note the difference between prevalence and incidence. It's very, very important. They are different things, but they can actually be maybe interchanged more often. So we have another concept, which is screening test. What is a screening test? They are those preliminary or early detection tests that is used to identify individuals who may have a disease but do not yet show symptoms. These people are called asymptomatic patients. Okay, so they have a particular disease in their body, is developing already, but they don't show symptoms yet. So screening tests help you to identify this type of diseases early. Why? Because when you identify this type of diseases early, it helps for timely treatment, early treatment of these diseases, and also help for prevention of complications. So let's take a look at different examples of screening tests. We have the pap smear, which is used for majorly for cervical cancer in women. Okay, so you conduct a pap smear for most women who want to know, okay, if they have a probability or if they already have cancer developing. So when you discover this thing early, you start treatment. Okay, we also have mammogram for breast cancer screening. Okay, we have blood pressure check for hypertension. We also have the HIV rapid test for early detection of HIV. So do you understand what a screening test is now? So there are different characteristics of a good screening test. So number one is sensitivity, is ability of that screening test to currently identify those with the disease, which is true positive. So a good screening test must be highly sensitive, okay? Number two is must be highly specific, that is specificity, okay? Is the ability to currently identify those without the disease. That's a true negative. It should not show maybe errors when someone has the disease and he say he doesn't have the disease. It can actually cause a lot of problem at the long run. Okay. So a good screening test must be highly sensitive, it must be highly specific. And another one is acceptability. It should be easy, it should be safe, and also acceptable to participants, okay, or the population that is going to be it to be used on. It also should be cost effective because number one, screening, most of the screening tests are being done on a very large population. On a very large population. Can imagine HIV test, rapid test kit is, I think, is for to some extent, it's very is affordable. Okay, because it's actually used to detect. Okay, most of the tests you run, or maybe some of the program you want to embark on, they tell you to go and run some tests, some screening tests to screen you if you have this particular disease, even when you're not showing symptoms. Okay, so that it should be very affordable because it's actually used for a large scale of people. So another vital example of this screening test is COVID-19 screening test. You remember when there was COVID-19, when people from other countries are coming into, let's say, for instance, Nigeria, they will tell them to go and conduct COVID screening. Yes, because you want to check if they have this disease, even when they're not showing symptoms or showing any sign of having COVID, they have to go and conduct the screening test. So when they have this, when you check, when you actually notice this, be able to isolate them and do other processes that is involved. So that's the benefit of screening test. So I want to ask you now, what is the difference between screening and diagnosis? We've discussed what screening is. So can you tell me the difference between screening and diagnosis? If you know the answer, you can just pause this video and you can make an attempt. Just write it in the comment section. There's difference between screening and diagnosis. So let's quickly check the difference now. Screening, we already say it detects potential diseases in healthy people, people that doesn't show symptoms. While diagnosis actually confirm disease in symptomatic people. That's people that are already showing symptoms. For instance, you have like headache, migraines, you're seeing symptoms. Sometimes you just say, oh, I think I'm having malaria or having typhoid. So diagnosis helps to confirm because you're already showing symptoms, you're already having different signs that you may be having this disease. So diagnosis helps to confirm in symptomatic people, while screening is majorly used in healthy people to check the potential of them having that particular disease. Now, another thing is screening is usually quick and simple to conduct. why diagnosis is often very detailed and should be very, very specific to actually say, okay, this is the disease that these symptoms is pointing at. So we also have screening are majorly used for preventive measures. Okay, why diagnosis is used for, for curative or confirmatory measures. Okay, so these are the uh, differences between screening and diagnosis, though most times they are mostly used interchangeably. Okay, so did you get the answer? Like most people that say you should pause the video and answer, did you get it? Don't lie to me, okay? So just let me know. But if you don't know, this is it now. So let's take a look at mortality. Mortality, anytime you hear of mortality, you're talking of death. Okay, mortality is talking of death rate. We have um just like saying maternal mortality rate. Okay, maternal mortality rate. That is the number of women that die due to childbirth. Okay, it also has a formula of calculating the number, the mortality. Mortality rate is equals to number of deaths due to a disease all over the total population of the people, okay, of that particular or that target population. So when I mention maternal mortality rate, I'm talking of number of women who die due to childbirth. Okay, so the number of deaths of a disease, let's say for instance, we want to measure the maternal mortality rate in Nigeria. I think at this present time it still stands as 1,038 per 100,000 persons or per 100,000 women. For the last time I checked, I mean 800 rand. So measuring maternal mortality, it helps you to check, okay, are these people dying like more than expected from this particular disease or from this particular factor? Like, for instance, this maternal mortality, are women dying more due to childbirth? What are the factors that is making them to die more? What are the things we can do to prevent or to bring down this maternal mortality to make women not to die from giving birth? So that is maternal mortality rate, okay? The mortality rate helps you to know if people are actually dying due to this particular disease. It can be diabetes, it can be hypertension, it can be any disease at all, okay, or anything or from any factor, okay, in the environment. So that's the major aim of calculating mortality rate in a population. So there's a question, if there are 25 lung cancer deaths in 1 year in a population of 10,000, so what is the mortality rate of lung cancer in that year? So if you want to calculate the mortality rate, we say it's the number of deaths due to the disease, which is 25, all over the total population, which is 30. So we are getting 0.008333, okay, which is if you times it by 100,000 persons, you're going to be getting 83 deaths per 100,000 persons at that particular year. Okay, so that is how to calculate the mortality rate. I hope you really understand what we're talking about. Okay, so let's quickly check different exam questions, start question. So this question, you have to answer it yourself. So that you check if you actually learn something from this, our short tutorial. Number one, you have to define what is prevalence, what is screening, what is incidence. Can you differentiate between prevalence and incidence? If you can do this, that means you'll be following from our tutorial, and kudos to you. Well done, okay? But if you cannot, don't worry, you can just go over this again, and believe you're going to get yourself used to all these terms, okay? Number two, we have a calculation. If 15 new cases of typhoid occurred in a population of 10,000 at the period of study, calculate the incidence rate. I've explained to you, and if you follow through the class, this is going to be like a bonus, very easy to answer. So just solve it, quickly solve it, and let me know your answer in the comment section. I'm going to be able to check it and tell you, okay, yeah, you got it, and maybe you did not get it. So another question says, if a measurement of cancer is taking a population of 40,000 people and 1,200 were recently diagnosed with cancer in the year of study, and 3,500 are living with cancer, what is the prevalence of cancer in the population? And also calculate the incidence rate. Can someone try this? Please try all these questions I'm asking you in the comments. Just try and solve them. Tell me your answers. And I'll also be solving and telling you my own answer in the comment section. Okay. So this we've come to the end of our learning on a short course on knowing what is prevalence, incidence, and screening tests. And I want to say thank you so much for joining us for today's discussion. Please don't forget to subscribe to the channel and also share this our class discussions maybe to your friend or to those groups that you belong that you know that they actually need this. They're offering the course or they actually need these materials. Okay, it's very simplified, it's very easy to understand, and I believe I also want to hear your feedback too in the comment section. Okay, so I'm going to definitely see you in the next class. Thank you so much and have a good day.